That there's approximately 1.7 million TBI diagnoses in each or in the country in emergency rooms annually. This does not count the number that don't go to the emergency room, which they figure is almost as much, if not more. We know that between 9.6 and 20% of the veterans returning from worldwide conflicts have TBI. Now, actually, in Colorado Springs, they have about 30,000 active soldiers that are coming back now, and their percentage is around 26%, which is quite a bit more. Another one that's most important, 1 out of 5 high school athletes playing contact sports will suffer concussion this year. Some of the symptoms associated with TBI, I'll move that a little bit, okay. And these vary for each individual, but these are the more common ones. Headaches, visual disturbance, cognitive impairment, that's your ability to show emotions and to think, loss of executive skills, that's from the temporal region, that's your ability to do tasks and formulate plans. Depression, very common, balance problems. We see it not only in TBI, we see it in Parkinson's and other diseases, and vertigo. You'll see such things as emotional outbursts, relationship difficulties, that's a huge one, and very often leads to suicide. Memory impairment, dizziness, loss of word recall. Now, I just went through surgery here 2 years ago for heart attack, and I went through it again here about a month ago. So I have a little bit of word recall problem now from all the anesthesias that I took. Substance abuse, we see marijuana, opioids, as we're beginning to see here in Colorado. Sleep problems, very hard to get these people to sleep comfortably, and anxiety. These are some interesting numbers that kind of come to Colorado. Half of the homeless men have traumatic brain injuries. We got a lot of homeless people in this state, as we well know. Teenagers who have had a concussion very often have suicidal intendance, ideation. 90%, now the Denver Post said 93%, 90% of the people that are incarcerated in the state of Colorado have TBI. That's just huge, it's unbelievable. Teen concussions increase the risk of depression. This is a small sample out of a group of patients that we did. First patient was unemployed. He had been involved in a blast injury over in Afghanistan when he was coming out of the turret of his tank. Went off right next to the tank. Suffered TBI, PTSD, etc. A lot of marital difficulties after he came back. He was suicidal. This guy is now a master electrician here in the state of Colorado for those people. Coors, okay? Female, nurse, unemployed for 8 years? Yes, it was. She's a cancer nurse. She happens to work at the same hospital I do, which is Lutheran. We treated her. She is now back to work, and she's not suicidal. We talked about some of the numbers to the things that we did. The first one there in the red is the Beck's depression scale, that one. After treatment, it had dropped from 25 to 12. That's almost a 50% drop. Quiz, which is another depression scale, went from there down to there. But the most important ones is that second one over here. Out of those 10 patients, we had 5 that were suicidal. We got done, we had 0. Patients with sleep disturbance, and that is one of the big things that they all suffer. Went from 10 down to 0. This is a copy of a brain scan on an MRI. Doesn't really show us much, just shows an area of white, which is an area of injury. These are the type of scans that we do, and Dr. Henderson's going to talk about it just in a minute. This is called a SPECT scan, but the big thing here is you notice the blue area right here and here and the difference before treatment and the difference after treatment. The blue area here, before treatment, after treatment. That's the area of brain activity which is diminished. That blue is not good. We want to see it all turn different colors, primarily gray. This is a young man. I get the biggest kick out of his because his dad is a senior engineer at Raytheon. Any of you know who that is? That's a huge, huge company. He's now playing chess with his dad. He behaves himself. He likes his grandmother now. He is a totally changed young man and just exciting to be around. And he beats his dad.